This is a neuromuscular electrical stimulation to strengthen the quadricep muscle using pulse current. So patient positioning, we have the patient lying supine with their body just kind of relaxed. Their knee is going to be under this bolster to try to keep that knee bent at about 20 degrees. So that's going to take out the slack in the quadricep muscle, and that's going to let us get that isometric contraction without the muscle needing to move. So another thing to help with that isometric contraction, we have her strapped down, and this leg stabilized with cuff weights, and then a band holding that leg down. The electrode, the larger electrode, proximal electrode, is going to be up here on the medial border of the rectus femoris, targeting that femoral nerve in the femoral triangle. And the distal electrode is going to be on the fleshy part of the vastus medialis. And then we also have those just strapped down. So the patient was then educated that throughout this, she is going to feel kind of in 10-second bursts, she'll feel a sensory, and then the sensory will kind of make her muscle contract or grab, is kind of a better way to put it. And then the muscle will then relax for 50 seconds. So this is just going to help strengthen the muscle without fatiguing it. And then she is just instructed to remain completely relaxed. She doesn't need to do anything extra, but just let the machine work. So some of the indications for NMES for strength is post-op, after surgeries, edema, general strengthening, any other orthopedic problems that kind of don't allow the body to do it on their own. Some contraindications that we already cleared our patient for are if the big rocks are kind of not doing it over someone's abdomen who may be pregnant, not on the carotid sinus, there's no severe edema. That should be about all the big rocks. She doesn't have any cardiac pacemakers or any other unstable arrhythmias. And so we cleared her all of those contraindications and precautions before. For patient safety, when we set her up, we made sure that the table was clean and we were using all clean equipment. We cleaned the electrodes and we cleaned her skin before placing the electrodes. Made sure the machine was plugged in, working correctly. Everything was plugged in before we set her up on the electrodes. And after the procedure, after the on-off cycles, and the time was up, we will then check her skin to make sure there was no other anything happened, like redness or sores.